Hello, everybody. Let's discuss the upcoming MRCS stem cells question. Okay, let me discuss this briefly in a professional way. So, what is going to be the first question? The first question is, what are the types of stem cells? There are so many controversial papers about the types of the stem cells, but the answer that we will need from you, and it is very scientific in the exam, is number one, mention the embryonic type, number two, the adult type. So we have the embryonic type when it is starting from fertilization and zygote formation. It means it's only exclusive to the intrauterine life. The adult type, which is starting from delivery to death. So only mention the two types. That's all what we need from you. Question number two. The name of adult type. Look, also it is a controversial question, but the answer that we will need from you in the exam is the spermatogonia, as it was believed that it was only unipotent, but in vitro, it showed pluripotent behavior. What does this mean? The germ cells in the seminiferous tubules of the testicles, it was believed for a long time that they are unipotent. It means it gives rise to one type of tissue, which is the sperms. But actually, when they were isolated in vitro, when you find vitro and vivo, the vitro word, it's T for the tube. It means the lab, the laboratory. But in vivo, it means in the vessel, in the blood. So in vitro, when they were isolated in the lab, it showed pluripotent behavior. They were giving rise to all types of tissues, not only one type. I will explain this in more simple words. Where did you come from? From mom and dad, right? So one sperm and one ovum makes whole human body, all tissue types. So it means the origin of the stem cells are already existing in testicles and ovaries. We don't need to inject external, like doctors who doesn't respect the dignity of this profession. They lie to the patient and say, we will inject you by stem cells. The clue of its existence in adult life. Well, the clue are two things. One I just mentioned, that from where did you come from? Mom and dad. Okay, next, the existence of the famous tumor teratoma. And this teratoma arises from the testicles and ovaries. And based on that, and the post-surgical excision, the specimens show tongue, teeth, hair. It means that they were giving rise to all types of germ cell layers, the ecto, the meso, and endo. So this is, we have two clues now, not one. That the first clue is our own existence. The second clue is the teratoma existence. Number four, the tissue types arise from it. All types. The ectodermal, the mesodermal, and the endodermal, they arise only from the pluripotent or tutipotent or multipotent, but unipotent, no. The potency, it means what is the tissue type arise from them. I hope it's more clear now. Next, the pluripotent and tutipotent, they are multipotent, but the unipotent is unipotent. Okay, so for the pluripotent, for the multipotent germ cells, we have the pluripotent and tutipotent, and they both give rise to the embryonic tissue, and it means all tissue types, except that the tutipotent, they give rise to The extra embryonic tissue, it means outside the embryo. So what it is the placenta in simple words. Next, the types of stem cell therapy. Number one, you inject in stem cells. You inject it. It is autologous. It is from the same patient. Or allogeneic is from another person. And this number one, actually, I have been working in the stem cells field for a long time, so I don't believe in number one at all. Number two, yeah, it is. We had very, very great results via stem cells enhancement, and it's via stimulation of your own stem cells. A stem cell in the ovary or stem cells in the testicles, you stimulate them in a benign way to enhance and to induce a cellular-based level O2 repair. I hope it's more interesting now. Next. The next slide, I shared this on the group, but now I'm discussing this in more details. Please focus with me. This is for exam and for your career and for future and for your teaching sessions anywhere in the world. How to monitor your resuscitation efficacy, or when you monitor any patient in the emergency department. So you will resuscitate the patient who's coming from external injury, which is the ATLS protocol, or monitoring the patient which is already admitted inside the hospital, and it's gonna be the CRESS protocol. We will discuss this in more details later on, but let me explain the must to be mentioned 9 items. They must be mentioned. Those 9 items in anywhere on the planet, on teaching session, exam, on the street, to students. When you travel to the United Kingdom, you will be obligated to give teaching sessions, so you must be presentable. And that's what you must show in the exam. I can assess in teaching, I can assess in audit, I can assess in research, how presentable you are. Okay, so to guarantee the full mark in the exam, the 9 items must be mentioned, because I have met many candidates all over the world. I ask this question, like, how do you monitor your resuscitation? He just say heart rate, blood pressure. So 7 items missed. 85% of candidates in MRCS Part B asking exam, they all forget 7 items from 9. They say just blood pressure, heart rate. This is bullshit. You are not a real surgeon when you speak like that. You must say the cardiovascular system, which is the most important. Respiratory system, it is reflected on the cardiovascular system, and based on that, the metabolic and the early warning scores. So, and in your answer, you have to emphasize on hemodynamic stability. I will assess the hemodynamic stability and try to restore it normal parameters. Next, in more details, I can say that, look, this is 1, 2, 3, and last one is 4. The cardiovascular system, what you're gonna assess in the cardiovascular system. The heart rate, blood pressure, okay, and capillary refill, central venous pressure, and urine output. All those 5 assess the integrity of the cardiovascular system. Number 2, respiratory system. Just count the respiratory rate, because based on there is sufficient blood flow or non-sufficient blood flow, your heart rate will become higher or lower. The metabolic, the capillary blood glucose and temperature is a reflection of the metabolic status of the patient in the monitoring tool. Because low blood glucose, high blood glucose, you must put it in the normal levels. The temperature too, it is hypothermic, it's hypothermic, and put your measures. So when all parameters, when they come back to normal levels, so your resuscitation is 100% perfect. If not, you miss, something is missing. Maybe your resuscitation is great, but you are missing something in the diagnosis. I have met from my experience a lot of patients. Two special cases you will find in the United Kingdom. The septic shock, you give patient fluids, and you don't know why. He's not responding to anything. He just needs vasoconstrictor to increase the systemic vascular resistance, and the problem will be solved. Yes, you are doing good resuscitation, but you forgot to think about the septic shock. Okay. Number two, someone have an internal bleeding. One time we met, heavyweight left from heavyweights, he was having bleeding piles, but it was internally, it was not externally, and he was bleeding and bleeding and bleeding. We couldn't know why, but suddenly we suspected that by doing the fast scan. When you saw the fast scan, you're scanning for quadrants. Okay, I think everybody in the pelvic, in the splenic area, in the hepatic area, and in the chest area, in the pericardial area. So those things, when you are aware about how to deal with the situations, you will save more and more lives. Number four, the early warning score assessment. So this is when the patient is already admitted, it is not coming from the street in car accident or whatever. So the early warning score assessment, it must come back to normal parameters or become zero. So it means you are doing your job great. I hope this presentation is going to be helpful. I'm waiting for your questions. I'm waiting for inquiries. I hope that everybody is becoming more productive in the group. Have a nice day and thank you.